Welcome to MLT 101, Human Anatomy. My name is H1 Barnes, and this lesson's topic is the body positions, planes, cavities, and directional terminology used in the lab. Medical personnel normally refer to the body as if the patient was in the anatomic position, regardless of the actual body position that person is in. This is done for consistency in describing the direction or the location of a given point on your patient's body. A person in the anatomic position is standing, erect, with feet parallel, arms at their sides, and their eyes and palms facing forward. Two other body positions of particular importance, especially when working in phlebotomy, are the supine position, where your patient is lying horizontal on their back with their face up. The act of turning the palm to face upward is called supination. This position is especially useful if you're about to draw blood from somebody who knows that they are likely to pass out when they have their blood drawn. In that circumstance, if your patient is sitting up in a chair and they do pass out, you have the concern that now you have to hold them up while they've got a needle in their arm, because a lot of people go completely limp while they're unconscious. You don't want to be in that circumstance, because then you have to both support them, prevent them from falling and injuring themselves, and prevent the needle that's in their arm from causing any damage to them. You can avoid that situation by preemptively having your patient lay back in a bed or adjustable chair in the supine position. The other position is the prone position, which is the opposite of supine, in which your patient is lying face down. The act of turning the hand so that the palm faces down is called pronation, a position sometimes used during blood collection. I personally have never needed to use this position. Whenever I've needed my patient to lay down, I've always had them lay down on their back rather than their front. The planes of the body. A body plane is a flat surface resulting from a real or imaginary cut through a body in the normal anatomical position. Areas of the body are often referred to according to their location with respect to one of the following body planes. The frontal plane, also known as the coronal plane, divides the body vertically into front and back portions. The sagittal plane divides the body vertically into right and left portions. If that sagittal plane happens to be in the center, in the middle of the body, it is then referred to as a mid-sagittal or medial plane, and it divides the body vertically into equal left and right portions. There is also the transverse plane, which divides the body horizontally into upper and lower portions. I think of the frontal plane as fairly easy to remember. The word front is in the name. Think front and back, frontal plane. Then you have the mid-sagittal or medial plane. Medial sounds a lot like middle. I think of it as a line right in the middle of the body between left and right. Next, we have body directional terms. Areas of the body are also identified using directional terms, not just planes. Directional terms describe the relationship of an area or part of the body with respect to the rest of the body or body parts. Directional terms are often paired with a term that means the opposite. If you've got a term for up, you have a term for down. A term for away, a term for close. Like that. Our directional terms start with anterior or ventral, which means to the front of the body. Posterior or dorsal, which means to the back of the body. External, which means on or near the surface of the body. Internal, within or near the center of the body. Medial, there's that word again, which means towards the midline or the middle of the body. Lateral is the opposite of that. It means toward the side of the body. Palmar, the definition is in the name. Palmar means concerning the palm of the hand. Plantar, concerning the sole of the foot. The common example here is if somebody has a plantar's wart, it means it's a wart on the bottom of their foot. Proximal means nearest to the center of the body or origin. Distal means farthest from the center of the body or origin. Most people new to medicine are not familiar with those words. An example of what those would be is, let's think about our elbow and our hand. Our hand would be considered distal. Our hand is farther from the center or the torso than the elbow is. The elbow would be considered proximal because it's closer to the center of the body than the hand is. You can do the same thing if you think about a foot and a knee, or even a finger and a wrist. Next we have superior, which means higher, or above, or toward the head. If I say that the shoulders are superior to the belly button, in medical terminology, that does not mean I'm saying the shoulders are better than the belly button. That means the shoulders are closer to the head than the belly button is. Inferior, beneath or lower or away from the head. The opposite of superior. In medical terminology, that means below or in the direction that is away from the head. We also have cavities of the body. Various organs of the body are housed in large, hollow spaces called body cavities, and are divided into two major groups. We have the dorsal and the ventral cavity. The dorsal, or the posterior cavity, is located in the back of the body and includes the cranial cavity, which houses the brain, and the spinal cavity, which encases the spinal cord. The ventral, or anterior cavities, are located in the front of the body and include your thoracic cavity, which primarily houses your heart and lungs, your abdominal cavity, which holds your stomach, liver, pancreas, gallbladder, spleen, and kidneys, and your pelvic cavity, which houses your urinary bladder and reproductive organs.